Hi, guys. A wonderful day to you all. Yeah, you know what we'll do right here, isn't it? Calling it again. Yeah, today we are going to be talking about something that is needed, especially to the females. Alright. I know that vaginal discharge is normal part of women's reproductive system, and it can vary in color, texture, and smell throughout their menstrual cycle. While some changes in vaginal discharge are normal, others can indicate an underlying health issues. So today we are going to be talking about vaginal discharge and what they mean. Vaginal discharge and what they mean. We are going to dive into it and expand so that some of the discharge that you see, you can be able to tell if it's normal or not. Do you understand? Because understanding vaginal discharge is quite essential part of maintaining your reproductive health. I always tell my client that, like always. So we are going to go through the different types of vaginal discharge and what they mean or what they might signify. All right. So number one, we are going to be talking about the clear and watery vaginal discharge. Clear and watery vaginal discharge. Normally in appearance is like a gentle, it's quite gentle. It's like a gentle, clear stream. The way it appears in color, the appearance, that's how it is. Just gentle, clear. I would even say clear water, but I like using the word stream. Then in texture, it's as light as the morning dew. If you have ever experienced the way morning dew is, that's how it is. Smell, it's usually it carries no notable odor at all. Now, I'll tell you what this actually signifies or what it means. If you are having this is your body's way of saying that you are fertile. Like you are fertile, you are in a fertile phase. It's simply put, that you are in a fertile phase or part or time. If that's a clear way of understanding for you, and it's entirely normal. Please don't panic. It's normal. Once you experience this, it's normal. It might be a hint that at the perfect time of conception. In Nigeria, I would say that it's a perfect time if you won't get belly. Anyways, don't mind me. I like to play around sometimes. All right. Number two, we are going to just talk about the white, thick, and clumpy discharge. There's a reason why I call that that way. The white, thick, and clumpy discharge. In appearance, it resembles creamy lotion. Your lotion you have. That's how it appears like. It appears like your creamy lotion. Then the way it feels, texture. It's how would I put it for you? Do you know the way cottage cheese is? That's how it is. It's a bit like cottage cheese. That's how the texture is, yeah. And then the smell or scent, as the case may be, it might have a mild toffee smell or scent. It's mild. It's not really harsh. Now, if you have seen this, what it means, or if you have noticed this, it could be yeast infection knocking at your door. It could be yeast infection knocking at your door. So it usually comes rather with itching and discomfort. But I would advise you not to worry. Yeast infection is treatable, so it's not something that you should worry. It is when you don't pay attention to your body. That is part of the reason why I'm doing this podcast, for you to understand the kind of discharge that you have, so that we can be able to treat it and know on time. Because when you don't attend to this on time, it might be a problem. So do you get it? If you are following, you know that we've talked about two things already. Two types of discharge. The first one we talked about was the clear and watery discharge. Then the other one we talked about was thick, white, and clumpy discharge, or you can say white, thick, and clumpy discharge, as the case may be. So right now we are going to be talking about the clear and stretchy discharge. It's clear, but when you touch and touch it with your finger, or you just and you try to open your hand, you see that it is stretchy. Just try using two fingers, you notice that it is stretchy. I call this like egg white discharge. The way egg white is, I'm not talking about the yolk, please. That's how this particular discharge is. And the way it comes in, or look like, it looks like a transparent and slippery egg white, basically. I said it before, the way the egg white is, that's how it looks like. So just imagine the egg whites. I don't mean after cooking, I mean before you cook your egg. The way it is, not the yolk. The way it is, that's how it actually looks like. All right. The way it feels, or texture, it can actually stretch like if like a friendly rubber band. You know how rubber band is now. Just the way it stretches, like the way you have your normal friendly rubber band. That's how it is. Okay. And then the odor, it is absolutely odorless. It is odorless. Okay. And what it means, the significance to this is that this is your body's way of telling you that ovulation is happening, making it prime time for baby making. It's nature's invitation to for you to conceive. If you remember the last one we talked about, the thick, clumpy, and white discharge. If you notice, sorry, not the thick one. That should be the first one we talked about, the watery. Sorry, the thick, clumpy discharge is talking about yeast infection. When you see that, the clear and watery discharge was what I was talking about. That's when you're in your fertile phase. If you remember, I think I used the word fertile phase. Yeah. So it might just be like time for conception, but now when you notice that you have a clear and stretchy discharge, just know you should just be like 100% sure that your body's way of telling you that ovulation, you are ovulating. This is it. And then it's if you want to get pregnant, this is the best time for you to get pregnant. All right. So I just hope you're following, please. This podcast won't be long. By the way, this podcast was inspired by a friend. We spoke, and she just said something that inspired this. Right, so big shout out to you. I call her. No, I wouldn't want to do that on this podcast. But if you are hearing me, if I say okay, you understand what I mean. So okay, I'm saying you inspired this, and thank you for doing this. All right, we'll just go into the next one, which is yellow or green discharge. Yellow or green discharge, or green or yellow discharge, as the case may be. Now, the way this particular discharge appears, it comes in shades of yellow, it comes in shades of green. So just be vigilant, just be focused to understand the type of discharge you are having, and the color. Now, if the texture is consistent, you know that there's a problem, because to be very honest, such discharge, they actually vary in consistency. So they don't have this particular way of staying. They don't have it at all. It may be thick, it may be thin. So it actually vary in texture. I'll be very honest with you. Like, it's very in texture. Okay. Then the way it smells, to be very honest with you, it is unpleasant. It has this foul smell. I don't need to beat around the bush. No need for me to start saying stuff. It has this foul smell. It has a foul odor. It's actually unpleasant. So and then what it means, when you have such discharge, yellow or green discharge can be a sign of an infection, madam. It can be a sign of an infection, such as what I call BV, which means bacterial vaginosis, or the normal STI. So if you experience this type of discharge, it is advisable that you consult a healthcare professional. Please listen to my voice, okay? Don't feel like they are not important. Trust me, they are important. Right? These colors are red flags. It could signal an infection, like I said before. So just reach out to any of the healthcare professionals to address it, right? Or you could contact me. By the end of this video, I'll be dropping I've never done before. I'll be dropping my details to reach out to me. So by the end of this podcast, rather, I'll be dropping my details. So you just open your ears, please. All right. So what have we talked about? Just to recap, we are talking about vaginal discharge and what they signify. You know, the number one that we talked about was watery and clear discharge. Right. We also talked about thick, white, and clumpy discharge, and we went on to talk about the clear and stretchy discharge, which I said is the egg white discharge, if you remember clearly. Then just not quite long ago, we finished talking about the yellow or green discharge. Okay, so right now we will just bust and go straight up into the brown discharge. I see this a lot, like a whole lot. Brown discharge, in appearance, the way it looks like brown, or dark brown. Basically, that's how it looks like. It's brown or dark brown. Then the texture, the way it feels like, it can be thick or thin. Do you understand? It might be thick. The color might be thick. It also might be thin, just like the other way. Do you get it? And the way it smells, or the scent, I'm looking for a simpler term so that we all can, communicate easily and understand, like, very perfectly. I can say that it might carry a faint metallic or earthly scent. It's not the normal kind of smell, but it has this faint metallic smell or scent. If you are common with the metals, you know what I mean. Alright, so pay attention to it, okay? what this means is that it's actually old blood. Oftentimes, like, it's old blood making it exist. Do you get what I mean? It's an old blood that is trying to leave the uterus, probably from the menstrual cycle, that has the blood that has stayed in the uterus for like 2 or 3, basically, let's say 2 or 3 days, has been in the uterus and is trying to find its way out. The color definitely will change. That's what it means. It means, and I told you, I see this a lot because when some of my patients will come in the hospital and they'll be like, I have this funny discharge. I'll just ask some questions and I get answers. Okay? Make sure you are following, please. Don't forget, my name is Nurse Collins, and you are listening to Health Talk with Nurse Collins. Okay? All right. I said it before that it can actually show up at the start or end of your period. After you had sex. Probably after you had sex, and you are seeing that. Don't get scared. Provided that the color is what I just explained. Don't get scared. All right. If you can hear me, say yeah. I obviously cannot hear you, but I want to be sure that you are relaxed. If you have to take some water and then just relax. If I should explain this, it will take much time. Just know that brown discharge, right? The color looks like brown or dark brown in color, and I told you before that the discharge can be thick. It also can be thin. Then it may have slight, I said before, slight or faint metallic scent, okay, or smell. It's as simple as that. So I don't want you to overthink yourself about that particular color. And while I was also explaining it, I told you that brown discharge is often like an old blood that has oxidized, if I should use the word. It's typically seen as the beginning or end of your menstrual cycle. It's occur after sexual intercourse, basically. I know I said this before, but I just needed like a confirmation from you, alright, that you've gotten it. So we'll just move on to the next one, which is bloody or pink discharge. Bloody or pink discharge. Now, most ladies get this like a whole lot. They get this a lot, like a whole freaking lot. The color is usually bright red, pink, or light red. Just like that. That's how the color comes in. Like, then the way it feels, it may also vary actually. From being watery to going to being thick. It can vary. All right. It also the smell it also may have a slight metallic or iron-like odor. Since we are talking about blood here. Remember I said the other one is old blood. Anything that has to do with blood, if the smell is like also metallic, if you understand properly. Okay, and what it means, this type of discharge can occur during your menstruation. I don't want you to forget that it could occur during your menstruation, or let's say in the days that's leading up to. I don't know if you understand. By that I mean it may be. Let me look for a smaller word so that you could understand it properly. I want you to get it. what a bloody or pink discharge actually mean. This is like a typical sight during your period, during your period or the days before your period will arrive. I don't know if you understand. It may also appear after sexual activity as well, or certain procedures. I'm trying to make this very short. Okay, please just try and follow me the little way you can. Just try and follow me. Yeah. The next one is or the last one I know is the foul smell discharge. The foul smell discharge. Yeah. The way it appears, right? It's may vary actually. It doesn't have this particular way. Do you get it? So the color may vary if you get me properly. Then the texture, the way it feels, also it's thicker than the usual way. If you feel it and it's very thick, just know that there's a problem. Usually it is not light, but it is thicker than the usual kind of thick that you know. And this particular one, this foul smell discharge, the smell is strong. You could hear it because we are accenting the strong. It has this strong, foul or fishy odor. I know you're waiting for the word fish, and now you've gotten the word. This particular one, oh my goodness, it has this fishy odor. It is bad. Honestly, it is bad. So what it means is that a strong or unpleasant odor actually, especially the odd texture, my dear, the odd texture and color. It might just point to an infection, basically, especially bacterial vaginosis or STI, which are common. Basically, they are actually quite common. So what I advise in this situation is for you to see a healthcare professional. It is important. I'll just quickly run through what we did. Then we'll just quickly end it. Before I end it, I'll be giving my details as well for communication, just in case you want to communicate with me. Our topic today is vaginal discharge and what they mean. Okay, so the first one we talked about was watery and clear discharge. We also talked about thick, white and clumpy discharge. Also, we talked about stretchy discharge or clear, and it's cool. It's actually very cool. We also talked about clear and stretchy discharge, which I told you guys that is the egg white discharge. We talked about yellow or green discharge, and I told you that the yellow or green discharge can be a sign of an infection, which the client knows about, or you should know about too. Then the last two, brown discharge, which we talked about, was one of them. Brown discharge. We also have the bloody or pink discharge. Okay, thank you. All right. The last one before we go is foul, smelly discharge. Oh my goodness, like the smell can actually chase you away. The smell will chase you away. Okay. Time is going already. I thought this podcast would be like 15 minutes here. So sorry that it's taking your time. So sorry. Just try and understand. If you have to take it back to the top to play again, you could as well do that. Alright, you could do that. I want you to know that if you are experiencing an unusual or concerning vaginal discharge, it's something you should know and communicate with someone that is higher. By that I mean your healthcare professional. Just remember that your vaginal discharge or your vaginal discharge is your body's way of communicating with you. It has this communication it's giving you. That's why I'm telling you about the significance. Like the foul smelly discharge, which is actually very fishy in odor, and in fishy odor, foul, the way it smells, the odor is actually quite strong. So it's a way of communicating with you. Once you see something like that, you would quickly notice that there's an infection somewhere. Do you get it? And also, I want you to remember your vaginal discharge. I'll say it again. It's your body's way of communicating with you. This is like the second time I'm saying it, or the third time. So if it's ever seemed unusual or bothersome, don't actually hesitate to reach out to a healthcare professional. Honestly, they are out to help you. They are actually out to help you. I'm not at my father's place. You don't want to say that. Anyways, don't mind me. I love to play around. I told you guys I was going to drop my detail immediately after this podcast. So if you have a complaint, or you want to reach out to me for me to help you as a healthcare professional, you could reach out to me on +234 306 5790. I call the number again, +234 806 306 5790. And if you are in Nigeria, the number is 0806 306 5790. Alright, my name is Nurse Collins. Thank you so much for listening to my podcast. Until I come your way again, don't touch the dial. Keep listening to other podcasts, because next time I'm coming, I'm going to come with the person that inspired this podcast. Thank you all so much.